Welcome back. Did you know that breast cancer is one of the most commonly diagnosed cancers in women across the United States? Take a look at this right here. Approximately 12% or 1 in 8 women will develop breast cancer in her lifetime. And while many women are familiar with 2D mammography, to help detect breast cancer, there is a new 3D mammogram option. And this morning, Dr. Mignonne Morrell, she is a radiologist at University Medical Center. She is here to explain how it works. Welcome to the show, doctor.
Hi, thank you for having me.
Thank you so much for coming on. It's been a great conversation with many different doctors from LCMC this morning, and I'm really glad that there's now another option to help women fight against breast cancer. Tell me about the new 3D mammogram.
So, a 3D mammogram, or as it's technically called, is digital breast tomosynthesis, or DBT for short. And I'll start with how they're the same. So, a 2D mammogram and a 3D mammogram are done in the same standard compression. So, you come and you get your mammogram, and typically each breast is compressed in two different views. For a 3D mammogram, what happens is the X ray camera actually takes multiple pictures over an angle. And so, what that provides on the radiologist end, the doctor who reads your mammogram, we're able to see through the layers of breast tissue rather than just seeing all of the breast tissue in an overlapping fashion.
And I'm curious, when does a woman say, can I get the 3D mammogram over the 2D mammogram? Is that something that the doctor chooses?
Sometimes it is something that the doctor chooses. 3D mammograms are still relatively new. They've been out for a little while, but as we get more information on them, it's something that a doctor, particularly in ladies who have dense breasts, may choose over a 2D mammogram. Also, it's something that you can choose for yourself. Every lady with her report gets a notification of whether or not she has dense breast tissue. And all that means is it's a normal finding, but about half of the ladies in the world have what we consider more breast tissue than fatty tissue in the breast. That makes your mammogram in a standard 2D mammogram typically a little bit harder to read. It may hide a cancer a little bit more. And also, we're learning that ladies with dense breasts may have a higher risk associated with developing cancer. And so, digital tomosynthesis may help us look through those layers of extra tissue that are overlapping.
Very interesting. And you all just saw some of the risks that are associated with 3D mammograms. But another risk associated is that it does use a little bit more radiation, correct?
There is, because there are multiple X-ray pictures that are taken over an angle, there is more radiation that occurs with a 3D mammogram. But the key to remember is that all mammograms are very low dose radiation. And it's still within what we consider a standard of practice. And so we all have to, the federal government, we all have to practice within a certain standard, and that is within that standard.
Very important to know. And it's a conversation that even though I'm not a woman, I've asked my mother because I used to want to be a doctor, what age should a woman go and get her first mammogram?
That's a great question because there are a lot of different recommendations that are out there now. There's several. And what we typically abide by is the American College of Radiology and the Society of Breast Imaging recommend that any lady who's just of average risk, so that 1 in 8 population, that you mentioned earlier, if you're just of average risk, that you start screening at age 40 and continue on every year as long as you're healthy. There are some additional guidelines that have some looser recommendations for ladies in their early 40s, where you can choose after discussing with your doctor. But the key is there's not a scientific reason to not screen at 40. So I just want to make sure that that's clear.
And I know you're saying right here that, sometimes mammograms are ordered for younger women. Why do some younger women have to get mammograms early? It's because maybe there's a family history of breast cancer?
Absolutely. Sometimes you have relatives that have breast cancer, and particularly what we consider first degree relatives. So a mom or a sister. If you've had a mom or a sister who's had breast cancer early in their lives, you may need to start screening earlier than that. And typically, so if your mom was diagnosed at 45, you should start screening at age 35.
Very important to note. Hopefully, you all are writing this down because at the end of the day, a mammogram can save a life. So again, 40 to 44, depending on your family history. But if you have a family history, try to maybe get it in your early or late 30s. Thank you, doctor, for joining us this morning. You were great. And do not forget, here's what's cool, everyone. University Medical Center has funds available to patients to cover possible out-of-pocket expense from 3D mammograms. These are funds provided by Karen T. Stahl Research and Breast Institute. For more information about that, as well as women's health in general, visit umcno.org/survive.